So I'm so thrilled that more patients know that there are other options like physical therapy, massage therapy, acupuncture, mindfulness, and things like that. And who practices acupuncture? Credentialed practitioners are nationally certified by the NCCAOM. So if you have questions about finding a certified practitioner, this website would be great to go to. All right, so next slide, please. So how does acupuncture work? So the traditional understanding is the idea of movement of energy or qi through the body, through these meridians or channels that are associated with your organs in your body. Now, that could also mean moving blood, moving electrons through the body as well. So in the last 10 years, there's been a great deal of research dedicated to understanding the mechanisms behind acupuncture. And one of the most cited studies, a study was done by Dr. Helen Langevin in 2001. And what she did is she inserted needles into rats and was able to connect the insertion of needles to some therapeutic effects. And what they found was that when a needle goes into the tissue and the patient feels a certain heaviness sensation, and the practitioner feels a little bit of a resistance, the result of that act is a pain relief, a reduction in inflammation, and many other things at a cellular level. So that was an incredible finding. And they call this study the mechanical signaling. Now, other studies have also understood that acupuncture triggers a release of neurotransmitters and neuropeptides. What that means is that we can trigger the release by the nervous system, neuropeptides and neurotransmitters like beta endorphins, anti-inflammatory cells like cortisol, serotonin, and other chemicals. So it's like you're creating your own pharmacy or your own medicine in your own body. So it's quite amazing. And they describe this stimulation as creating chemical soup around the area of pain. So let's say you have a thumb joint pain or back pain, needles around that area will create this chemical soup to help you heal. That's pretty incredible. All right, so next slide, please. So if you talk about arthritic pain in acupuncture and Chinese medicine, we call this beast syndrome. And it's unique in that our strategy is to look at the individual person and identify patterns of disharmony. So in other words, not everyone's joint pain or everyone's pain is the same. So maybe your pain is heavy or hot or cold or sharp. All of those details matter as far as how we go about treating you. But in general, oh, I think something happened to the video. So anyway, so I don't waste your time. So there are different categories of joint pain, and we choose a strategy that best fits the individual patient. So I think we were on arthritic pain, but I think we can go to the next slide. So there it is, that's fine. So the benefits of acupuncture, it's an effective form of pain management for inflammation and pain. So it helps the body produce these beta endorphins. And what are beta endorphins? They're released by the body in your brain, and it helps to reduce pain. It helps to make sure that your pain relief lasts longer. So cortisol is an anti-inflammatory agent, and it helps reduce inflammation in the body. The benefit of acupuncture is that it's safe. We use tiny little needles that are sterilized and inserted into your skin very carefully and mindfully. It aids in reducing the need for more pain medications. It can be more effective when combined with usual care. So most of the studies that I've read indicate that patients get better results when they combine acupuncture with what they're already doing, and they get better results than just receiving usual care alone. And one of the most important ideas behind receiving acupuncture is that it can improve quality of life. Many people, as you may know, if you're experiencing chronic pain, it does affect your quality of life, anxiety, depression, fatigue, emotional challenges, so on and so forth. So it can be very helpful to treat that as well. Next slide, please. So here are just a few studies that I took a look at, one on knee osteoarthritis, on rheumatoid arthritis, and gouty arthritis. And as I mentioned, what seems to be most common with these studies is that acupuncture works well with usual care and is more effective than usual care alone. So I looked at a 2019 randomized controlled trial, and they found that AP is acupuncture and EA is electroacupuncture, where we add some electricity to the treatment. And they found that it was very effective for treating knee osteoarthritis. Electroacupuncture showed more improvement in quality of life. In another study, in a systematic review, acupuncture alone or combined with conventional care is effective for conditions of RA with no adverse effects, so very low risks. And finally, with gouty arthritis, acupuncture was very helpful in treating pain and more effective again with conventional treatment. Next slide, please. So what to expect when you get treatment with an acupuncturist? You'll start with a detailed assessment, looking at your tongue and your pulse, asking you many questions about your medications, your previous treatment, kind of where you are at emotionally, your quality of sleep, digestion, kind of the whole body assessment. A treatment might include manual acupuncture, which is just needles alone, or we'll add some electricity to that as well. Needle insertion may feel like a little sting. Most people don't feel anything, but if anything, you'll feel like a little sting, and needles are retained for about 20 minutes or more. So in an environment where you get acupuncture, it's typically a relaxing environment, very much like getting a massage. And we also include some soft tissue techniques, some cupping. Sometimes we prescribe herbs if needed. And a typical treatment protocol would be anywhere from 1 to 3 sessions per week. It just depends on the severity of pain. And like I said, relaxing environment. And the last thing is that more insurances now cover acupuncture. So it's good to have that verified before seeking an acupuncturist. And I believe that is it.